Hi, my name is Elia Kim Mabute, and I'm one of the family nurse practitioner from United States University. And I just wanted to ask for your consent to do this video presentation or video demonstration for my professor. It will be uploaded in YouTube as unlisted so that it will be my professor would can see this video and for grading purposes. Are you giving me a consent?
Yes.
All right, thank you. So, so before we start with our physical exam, we're gonna do some interview first. Okay. I just want to get some details from you, from like at least a background of your history. All right.
Okay.
So, can you tell me your full name?
My full name is Christopher and my last name is Jurilla. It spells Jurilla.
Okay, and your date of birth
Date of birth is September 28, 1990.
and your ethnicity.
I'm an Asian. I'm a Filipino heritage.
All right. And what brings you here in the clinic?
This is my annual. I want to do an annual checkup, so I want to check for all of my tests, includes my HbA1c, CBC, and
I see.
everything.
It's like a wellness check.
Yes.
All right. So before we start on the wellness check, can you tell me any of your history, your present illness history?
As of now, I don't have any history. That's why I came here for an annual checkup. I'm not pretty sure if I have some, develop some diabetes
Okay.
or hypertension.
But have you been diagnosed before?
No.
No.
But
Or-
I have a family history, so I
Okay.
just want to make sure, everything was okay for
All
me.
right. Sure. For now, so generally, how is your health right now?
I don't feel that some kind of having some symptoms of any illness, but I do feel that if we age, we can develop some illnesses like if we have some parents, we have hypertension or
Okay.
diabetes, we can also acquire that. So
All right.
I just want to make sure that everything is
Okay.
okay for me.
All right. And do you have any past medical history? Have you been diagnosed in the past with asthma or diabetes, some chronic illnesses? No.
Not
Do
at
you did you have any surgical history in the past?
Fortunately, no.
No. Okay, good. Um, do you have any allergies right now?
No.
You don't have any allergies. How about what are the medications are you taking? Do you take some medication for maintenance or supplements or vitamins
I only take vitamin C just for my immune system.
for immune system?
And for my eyes because I have some problem with my eyes.
Okay, you have problem in your eyes. Since when it was diagnosed with your
It's just
problem in your eyes?
just few months because I have a blurry vision.
Mm-hmm.
So the optometrist prescribed me some eyeglasses because they
Alright.
told me that I have some farsighted.
Okay, so presently you are having like a blurry vision.
Yes.
You've been seen by the optometrist for the last 3 months, for the
Yes.
last month,
Yes.
and then they prescribe your prescription glasses.
Yes.
All right, and then I just wanted to know if you have been hospitalized before.
No.
Have you had a surgery before in the past?
No.
No. Or recently, no surgery, no
No surgery.
hospitalization.
Yes.
All right, and then I just wanted to ask as well your immunization. Is your immunization up to date?
Yes. Even with COVID vaccine, I have 5 vaccine for COVID.
Okay.
I have Tdap, MMR.
All right. So your everything is up to date, even your
Yes.
childhood vaccination too.
Yes.
All right. And have you been exposed to any of contagious diseases like TB patient or TB person?
I guess yes, because my father was diagnosed with TB, but he was on treatment when we met each other way
Okay.
back in the Philippines, but I believe I had an exposure.
You had an exposure, but
Mhm.
you've been treated with TB before?
No,
No, good. But have you been tested positive for TB before?
no,
No, good. And have you been tested for any STD or
No.
hepatitis? No.
no,
No chronic illnesses right now?
no.
All right. Um, for your what do you call this? Uh, um, for your history,
Mm-hmm.
um, can you tell me? I will ask some questions, and can you tell me if who has it? Your mom, your dad, your sibling, or your um, grandma on your mother's side, or grandpa on your mother's side, or grandma and grandpa on your father's side.
Okay.
Okay, so I just want to ask if you have any history in your eyes, like a cataract or blurry of vision, any of the family members.
I believe my mom.
Your
had
mom
cataract.
had a cataract.
Yes.
Um, how about the problem with with their nose, ears, like having hard of hearing?
As far as I know, there's no one.
Okay. How about your cardiac problem, like chest pain or heart attack in the past?
No.
No. For the lungs, is there any family members who has COPD or asthma?
Um, my aunt has an asthma in my mother's side,
Mm-hmm.
and then I believe I mentioned earlier that my dad had a TB before.
TB before.
Yeah.
All right. And any problem in urinary tract, like had this kidney stone or had a UTI before?
I guess my mom had a UTI.
Yeah, you had a UTI.
Mhm.
How about stomach problem, like diverticulitis, in, gastritis, ulcer? Any of the family member has it?
No, I guess
No.
no.
How about musculoskeletal, like arthritis, joint pain? Does your any of the family member has it?
I believe my dad have arthritis.
Has arthritis.
Yes.
Do you have a family member who has been diagnosed with cancer?
Yes. It's my dad and my sister.
Your sister. Is it your sibling?
Yes, my
Okay.
sibling.
And then some of your is there any family member been diagnosed with genetic problem, like
Down.
Down syndrome or
No.
no?
Mhm.
All right. Any blood problem in
Like
the family, like leukemia or bleeding problem that's hard to heal, like thalassemia before?
No.
No. How about allergy to from the family members?
not that I know of.
All right, cool. And then I just wanted to ask as well, your a marital status. What's your marital status? Some of your social history.
I'm married.
You're married,
Yes.
and then what is your preference? Like yours, are you polygamous, monogamous, something like that?
Monogamous.
Monogamous.
Yes.
So, what is your sexual practices with your? Is it a husband or wife?
I have a husband.
You have a husband. So, what is your sexual practices? Have you been using condoms or using, or you've been tested for like HIV, STD, something like that?
We're using condom, but
Mm.
since it's also an annual, I believe it's also covered with my insurance.
Mm-hmm.
So I want to use that one to just check
Just check too.
my status.
Okay, cool. And then, how about your um, occupation? What is your occupation, my dear?
I'm working as a registered nurse in one of the hospital here in Houston.
Okay. And then, are you driving?
Yes.
So, are you driving safely? Are you using seatbelt
Yes, all the time.
all the time? And is there any guns in the at home?
No.
No guns.
No guys.
How about some insecticides? Cleaning materials. Are they at home? You know, scattered at home, or it's been in a closet?
No, it's in just one area
In just
in
one
our
area.
house. Yes.
Okay, cool. And then, um, do you have any? Can you explain to me your social condition right now, your living condition?
It's basically like it's just like work and then going back to the apartment, and then sometimes if we have some occasions we go to our friends, or sometimes if we're very exhausted with our work, we want to go around and see, uh, like we want to go to other places.
Okay. So, how do you? I mean, do you use any, like, for your family members? I would like to ask as well. Who's any of the family members been diagnosed with any psych problem?
Not that I know of.
Any of the family members use recreational drug or have been
No.
diagnosed with substance abuse?
No.
No. All right. So before I go to the review of your system, I just wanted to ask you as well if you are using tobacco, smokeless cigarette,
No.
or smoking.
No.
Have you been drinking alcohol?
Occasionally.
Occasionally. How many glasses?
I guess it depends on the occasion, but normally it may be 3 to 4 glasses.
3 to 4 glasses.
Mhm.
Okay. How about do you use any recreational drugs?
No.
Okay. How about what do you call this? Do you use any of the what do you call this? One of the, like, over the counter medications?
Sometimes yes.
Mm-hmm.
Like the melatonin,
Melatonin.
just to help me sleep at night.
Okay, so for your sleep, how was your sleep?
I have an altered sleeping pattern. I'm not pretty sure if I'm very stressed with my work or I'm burnout.
Okay, so how do you handle your stress?
I do sometimes just watch TV with my husband, or especially in this time we want to go travel.
Okay.
So that's our main stress reliever that we can do outside of work, just to be escape from the reality, or
Okay.
from our working environment, and from the place that we're in our apartment.
Okay, and have you been anxious lately and recently?
No.
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 All right. I'm gonna go with your review of system. You can just tell me if there's any problem or not.
Mm-hmm.
Okay. So just wanted to ask if you have any problem with your eyes or any blurry of vision.
Yes.
Did you have any conjunctivitis?
No, it's just the optometrist told me that I have a farsighted.
Farsightedness.
Mm-hmm.
Okay. Do you have any problem with your nose?
No.
Do you have any runny nose?
No.
How about your ears? Any discharges?
No.
Any ear pain? How about in the mouth?
Nothing.
There's no mouth sore.
Nothing.
Okay.
No.
Any problem with your chest? Did you have any chest pain or palpitation?
No.
Did you have any shortness of breath or cough?
No.
Did you have any problem in your abdomen, like abdominal pain, like
no.
what do you call this? Diarrhea, constipation. Do you have any problem in your urination, like pain in urination, burning sensation?
No.
Is there any problem with your joint pain, muscle pain,
No.
and your back pain?
No.
Did you have any problem in your endocrine, like diabetes, thyroid problem?
I don't know yet.
Okay, so do you have any problem in your blood, like a wound that does not heal?
No.
No, you don't have any.
Mm-hmm.
And then, is there a problem with your allergy?
No.
No. So way back to your family history, is there any any of the family member has a history of endocrine, like a diabetes,
Yes.
thyroid?
Yes. Both my mom and
Both mom and dad.
both mom and dad have a
has
diabetes. Yes.
Okay, so any psych problem with you? Have you diagnosed with any psych problem?
No.
Anxiousness?
No.
Okay, it's just the altered sleep.
Mm-hmm.
Okay, so after that, I think I'm gonna go for we're gonna do your physical exam.
Mm-hmm.
Okay, so before I'm gonna go for your physical exam, um, my patient is actually a male. So if a female patient, OBGYN history needs to be taken, like the last menstrual period, and also just need to need to ask as well if the female patient, if for the health maintenance, if the patient is doing a breast self examination. Since my patient is male, I need to ask him if he's doing like a testicular self examination. Are you doing it?
No.
No. Okay, so, and then since I'm about to do the physical exam now, I'm going to check supposedly the vital signs. I need to check the blood pressure, heart rate, respiratory rate, and temperature. But for the sake that we don't have the time yet, and also we don't have the equipment, so we're just gonna verbalize that one. And also, I need to get your height and weight. So since we don't have the weighing scale and the meter or the measurement to check your height, can you tell me your height and weight?
My height is I'm 5'7". My weight is about 168 pounds.
168 pounds and 5'7".
Yes.
Have you been diagnosed with overweight or obese?
I'm a little bit overweight with my height.
Okay, with your height.
Yes.
How about the family members? Is there any family members who are obese?
My parents.
Your parents are obese?
Yes.
Okay, so your mom and dad is obese. How about the grandparents, siblings? No.
I'm not pretty sure because my grandparents already died when I was still young.
Okay.
But in my siblings, I guess they also have like level 1 obese.
Level 1 obese. Okay. All right. So we're going to start your physical exam.
Okay, all right.
I'm going to move this one here. So I'm going to ask you to, first is after I check the height and weight, check your vital signs. So I'm supposed to go to do a hand wash. So apparently you don't have the sanitizer here or the faucet to do the hand wash, but you're supposed to need to just start do the hand wash. And then before we're gonna check for your overall health. I just wanted to ask, how are you today? Like, do you feel fatigued? Do you feel any fever?
No, I'm
No.
feeling good. Actually.
Okay, good. Right. So let's start. So I'm going to check for the visual acuity, which is the cranial nerve number 2. So I just wanted to ask you I'm going to show you a Snellen chart and you're going to read it for me. And then I wanted to cover your other eye. We're going to start with your left eye. And then you're going to cover your right eye.
Okay, sure.
So this is supposed to be like 6 feet, but it's due to the space constraint, we cannot move it. So just gonna move over here, and then I'm gonna ask you to read this letter.
CFDHJ.
Mm-hmm. And then what's the color of this?
Red.
This one?
Green.
Okay, can you cover your other side? Can you tell me what's the number of this? What's the letter? Can you read this line?
LTFPH.
All right. What's the color of this?
Red.
This one?
Green.
All right. Thank you.
Thank you.
So our visual acuity is intact. And then after that, I'm going to inspect the skin and hair and nails of my patient. So I'm looking at the hair. It's equally distributed. It's color black. The skin and the nails is, the skin is warm to touch. The color is appropriate for his ethnicity. There's no digital clubbing. Nail beds are pink. And there is no macule or papules that I could see of. And no scars. So if ever there will be a scars or lesions or macule, I need to check the asymmetry, the borderline, the circumference, the diameter, and the edge. If there's a lesion or a inappropriate macule or whatever those lesions are. Next is I'm going to check the HENT, which is the head, ears, head, eyes, ears, nose, and throat. So first, I'm going to palpate first the head. So the skull and head is no trauma, no deformities, and it's normocephalic. The eyes is, eyelashes is equally distributed, eyebrows is equally distributed as well. There is no pink, there is no conjunctivitis. The sclera is white. The pupils are equal, and there is the color of the conjunctiva is pink and moist. I'm going to check now the accommodation to the light. So I'm also checking the consensual of accommodation on the pupil. This is to check also the constriction of the eye that is in testing, and then the other eye that is not, I'm not testing. So the pupils is equally round, reactive to light and accommodation. And I'm going to ask my patient, I'm going to check also the extraocular movement. So this is also a test to check for the cranial nerve number 3, number 6, and number 4, which is the oculomotor, the abducens, and also the trochlear. So I was asked my patient, and also this is also to check the convergence of the eye. So I just want to ask my patient to look at the middle on this pencil, and then I'll ask my patient to follow the pencil. Okay, just look at the pencil. Just gonna bring up, down, side, side, and then look at the middle, and then look at the other at the back. Okay, just say look at the middle, and I'm moving forward. All right, so I checked the cranial nerve number 3, number 6, and number 4, which is intact, and there's no nystagmus, no ptosis, and all cranial nerves are intact. Now I'm going to check the pupil. I'm using my ophthalmoscope. Yeah. All right. So I'm using my ophthalmoscope. Can you move over here, Master? Thank you. So I'm using my ophthalmoscope. I'm checking the right eye of my patient. I'm handling my the ophthalmoscope on my right hand, and I'm checking the right eye of my patient using my right eye, and my left hand will gonna be on the forehead of my patient for safety. First, I'll be standing nearby to my patient at least 15 centimeter close or 15 inches, and then I'm going to look for the red reflex, and I'm gonna go straight to see the red reflex while my hand is over here. So now I'm looking, the optic cup and optic disc is optic cup optic disc ratio is 1:3. The optic disc is parallel to align with the macula with the fovea depressed, and the optic disc edge is crisp and orange in color. It's visible the optic nerve, the artery and the nerve, the artery and the vein is also visible. Same thing when I'm gonna do on the right eye, I'm gonna do on the left side of my patient. So checking the left side of my patient's eye, I'm on the left side. The ophthalmoscope is on my left hand. My right hand will gonna go to the forehead of my patient for safety. Same thing, I'm going to check for the red reflex. Slowly going into my patient's eye, and I could see the optic disc and optic cup ratio, which is 3:1, lateral to the macula with press fovea, and the optic disc is crisp on the edge and orange in color. The artery and the vein is so visible as well. After I've checked the eyes of my patient using my otoscope, I'm going to check as well the nose of my patient. So first is I'm inspecting the nose of my patient, and I'm going to palpate the maxillary sinuses, and then I'm going to check the nose using the otoscope. Okay, so as I observe, the nasal mucosa is pink and moist. There's no nasal deviation. The septum is in the middle, and I will test now the cranial nerve number 2, which is the cranial nerve number 1, which is the olfactory. I'll ask my patient to close the other nose, and then I will ask him to smell this one and tell me what he smells. Can you smell this one?
Okay. There's no smell. Lemon.
Okay. And then I'm gonna do the other side.
Mm-hmm. Salty.
All right, good. So cranial nerve number 2 cranial nerve number 1 is intact. And now after I check the cranial nerve number, the nose of my patient, I'm going to check the ears of my patient. As I inspect, there's no discharges and there's no deformities on both ears. Now I'm going to check the inner ear of my patient, as the outer ear is fine, using my otoscope. So since my patient is adult, I'm going to pull to pull up and back so that I could see straightly the ear canal of my patient. I could see that the tympanic membrane is pearly gray, intact, and the cone of light is at 5 o'clock. And then on the other side, it's 7 o'clock on the left, and then the other side as well. I could see as well the tympanic membrane is pearly gray, intact, and the cone of light is at 5 o'clock. So after that, I'm going to check the mouth of my patient. So this one we're going to check for the cranial nerve number 9, number 8, and number 12. So this is the hypoglossal, the hypoglossal, but cranial nerve number 9, 8, and 12. Can you open your mouth? So I can see that the teeth are equal. Well, there's no cavities. The buccal mucosa is pink and moist. And then I ask my patient to put his tongue out, and then I will ask my patient to say ah. Okay, so as I check, the tonsils are both not swelling, and the uvula is in the midline. Okay, and then I will ask the strength of I will check also the strength of my patient's tongue. I will ask my patient to tongue out and try to fight or like give a pressure on the tongue depressor on the left. How about on the side? All right. So the tongue is his tongue is the cranial nerve number 8 is fine and it's well equal, and then I will ask my patient to check the cranial nerve number 5 and 7, which is the facial nerve and the trigeminal nerve, which I will ask him if he could feel. We're gonna check first the cranial nerve number 5, the trigeminal, which is the 3 areas in the forehead, in the maxillary area, and in the mandible area. Just tell me if you feel this one by closing your eyes. Can you feel this?
Yes.
This one?
Yes.
This one?
Yes.
How about this one?
Yes.
This one?
Yes.
This one?
Yes.
Alright, so the cranial nerve number 5 is intact. How about number 7? I will ask my patient to frown. It's good. How about to pop your cheek? Very good. So, and that's a facial expression, and that's cranial nerve number 7 is intact. So, after that, I'm going to check the neck. So, the neck is well symmetrical. And then I'm going to palpate the lymph nodes. So, first is the preauricular. Next is the postauricular, submandibular, submental, anterior carotid, posterior carotid, subclavicular, occipital. So all the lymph nodes are intact and there's no palpable lymph nodes. And then I will ask my patient to swallow, and while I'm feeling the trachea. The trachea is in the midline, and I will ask my patient to swallow. Can you swallow for me? So my patient's cranial nerve number 12 is intact, and he could swallow. And then before I go down, I'm gonna check the hearing test for my patient, the whisper test, the Weber's test, and the Rhine test. So can you just move over here, sir?
Mm-hmm.
Just in the mid, no, just on the side.
Okay.
Thank you.
Mm-hmm.
So I'm just gonna cover. Can you cover your ear? No,
Mm-hmm.
with with your targus.
Oh.
This one. Just press this one. No, press this your tragus. There you go.
Okay.
And then I'm gonna whisper on the side, and then let me know what did you hear. Okay.
Mm-hmm. T5J.
All right. Can you do it on the other side? Can you cover? Okay.
T5J.
All right. So perfect. And then now, can you face to me?
Mm-hmm.
I'm going to check now the laterality of the hearing test, which is the Rhine test. So I'm going to place the tuning fork in your head, and then let me know if you hear the sound in your both ears. Did you hear the sound?
No. Yes.
Okay, one more. Did you hear the sound?
Yes.
All right. So now I'm gonna do the Weber's test. So I'm gonna put this tuning fork on your back of your ear in the mandible area, and then let me know if the sound that you hear is already done, and I'm gonna put in front of your ear. Okay. Finished.
Yes.
Finished.
Yes.
Mm-hmm. Finished.
Yes.
Next one. Mm-hmm.
Mm-hmm. Yes.
All right. So the bone conduction is shorter than the air conduction. So now after I move down, I check the neck, and then the swallowing. I check the lymph nodes. I'm going now to check inspect the chest of my patient. The ratio would be, the anterior posterior ratio is 2:1, and then I could see that there's the chest of my patient is well symmetrical. My patient is breathing normally. There's no there's the what they call this, the neck is, the jugular vein distension is not visible on both sides of the neck. The chest is equally expanded and as visible. Now I'm going to check the I'm going now to palpate the tenderness, or to check the costovertebral tenderness. So I'm going to palpate the chest, and there should be no pain that will be heard. Okay, and then now I'm going to do the tactile fremitus. So can you just tell me the word 99 while I'm just doing my tactile fremitus?
Of course.
All right. Say 99.
99. 99. 99.
One more.
99.
All right. On the back, I'm going to check the back using the tactile fremitus, asking my patient again to say 99. Say 99.
99. 99. 99.
All right. And then, since my patient's already on the back, I'm going to check for the respiratory excursion, or the expansion of my patient. It will start to the posterior. So I'm gonna place my hand at the back, and I'm going to ask my patient to inhale. and exhale. All right. So that's the respiratory expansion, and it's well expanded. It's equally moving in and out, as well as in the anterior. We're going to check the lung expansion. I'm going to ask my patient to inhale and exhale. All right. So we've checked that one already. So I'm going to go after checking the respiratory excursion. I'm going to percuss the chest versus the anterior using the ladder motion. So I'm going to start here in the front. Next. So on the anterior is we could hear the resonance sounds. And then now I'm going to go to the back. Same thing what I did to the front, to the anterior part. The using the ladder motion. Start from here in the top, from the apices. So we could hear all the resonance on the back. Now we're going to check for the diaphragmatic excursion. So to do the diaphragmatic excursion, I'm going to ask my patient to exhale, and then while I'm doing my the percussing. So just maintain the exhale. So we could hear the resonance sound is until here. Now I'm going to ask my patient to inhale, and then we're gonna continue percussing, and we could hear the dull sound until here and until here. So this is the diaphragmatic excursion for the lung sounds. So after that, after percussing, I'm going to do the auscultation. So we're gonna start from the we're gonna start on the anterior side. So using the diaphragm of my stethoscope, I'm going to ask my patient to breathe normally if I'm going to auscultate the anterior part. Alright, after that, I'm going to do on the posterior side. Same thing with the ladder motion, same way that I do to that we did to the percussion. After the posterior side, we're going to auscultate the lateral side of my patient, both sides. All right. So after after I auscultate after I check the thorax and the lungs of my patient, the lung sound, I'm going to ask my patient to lie down because no, first I'm going to serve first the chest for any heaves and lifts, and if there is any visual palpitation, and I could see that there's no visual palpitation on the chest of my patient. Now I'm going to ask my patient to lie down. Can you lie down for me, sir? So as my patient will gonna lie down, I'm going to check as well and palpate the PMI, or the point of maximal impulses. So to check the point of maximal impulse, I'm going to ask my patient to turn on the left side of my patient. Can you turn that side? And then I'll place my hands into the chest and feel the PMI, or the point of maximal impulse. All right. So, and it's normal. And then after that, I'm going to check for the pulses of my patient. So first is I'm going to check the carotid pulse, and we cannot palpate the carotid pulse at both sides, so we have to do it one side and another. So I'm gonna palpate. It's +2. That's good. Now next is the radial, and then the brachial, and then the femoral, the popliteal, and then for the postibial, I'm just gonna remove your socks, sir. The postibial, and then the dorsalis pedis. Same thing on the other side, the dorsalis pedis, the postibial, the popliteal, the femoral, the radial, and the brachial. So after checking the pulses are no bruit and no frill and +2, and the amplitude. I'm going now to auscultate the apical, the aortic pulmonic valve, the Erb's point, the tricuspid valve, and the mitral valve. Aortic valve is located at the right second intercostal space. The pulmonic valve is located on the left second intercostal space. Erb's point is located at the third intercostal space, mid-sternum. And the tricuspid is located at fourth intercostal space, mid-sternum, and also the mitral is on the fifth intercostal space, mid-clavicular line. So I'm gonna auscultate first the carotid to hear for any bruit using the bell of using the diaphragm of my stethoscope. No bruit. So I'm gonna start with the aortic, with the bell, with the diaphragm, and then the bell. Next is the pulmonic, the diaphragm and the bell. Next is the Erb's point, diaphragm and the bell. Next is the tricuspid, diaphragm and the bell. And next is the mitral, diaphragm and the bell. So after that, after what they call these, auscultating the aortic, pulmonic, Erb's point, tricuspid, and mitral, we're going to start now the checking the abdomen of my patient. So I'm going to ask the consent of my patient to, if it's okay to lift the clothes,
Yes.
going there his clothes to the uh, to expose the belly of my patient.
Yes, it's okay.
All right. So as I observe, first is to inspect. So I could see that the color is equal. There's no jaundice. There's no visible peristalsis. So after the inspection, I'm going to auscultate the abdomen. So I'm going to do a system which is I'm going to start from the right lower quadrant, then go to the right upper quadrant, then next is to the left upper quadrant down to the left lower quadrant. So as upon auscultation, the um uh, uh there's a normal vowel sounds that I could hear, and then um after I auscultated the four quadrants, I'm going to auscultate the renal arteries, the iliac arteries, and the femoral arteries on the both side. But first, I'm going to auscultate the abdominal aorta. First is to locate the abdominal aorta using my two hands on the middle to see if there is any palpitation, and there is no palpitation on the abdominal aorta. Next is I'm going to auscultate the abdominal aorta. The next is the renal arteries. Next is the iliac. And then next is the femoral. Alright. So after auscultation of the renal, iliac, and femoral arteries, we're going to do the light palpation. So with the same system from the right lower quadrant going to the other side to the left lower quadrant. Using the light palpation, using my one hand, going to palpate. You have any pain on here?
No.
You have any pain on here?
No.
Here?
No.
So for the light palpation, there's no tenderness, no pain, no masses that I felt. I'm going to start to do my deep palpation using my two hands, starting on the right lower quadrant, then right upper quadrant, then left upper quadrant, and then left lower quadrant. So after that, after I palpate, I'm going to percuss the I'm going to palpate for also the organs. So I'm going to palpate the liver. It should be in the right upper quadrant, below the costal line, 1 centimeter. I'm gonna put my other hand underneath, and I can feel this one. And then also I'm gonna need to palpate the spleen. I will ask my patient to inhale. All right, I cannot feel anything. There should nothing to be felt in the spleen. Next is I'm going to palpate the kidney on this side, on the both side. And there should not be, the kidney should not be palpable. So after that, I'm going to do the percussion on the both four quadrants of the abdomen, and then after that, we're gonna do the liver span. We're gonna check the liver span by percussing. So the fourth quadrant is tympanic. Next, I'm going to do I'm gonna percuss the liver span. So the liver span is here, and you can observe it by palpation, and it should be dull sound. And then on the other side, we're gonna percuss for the spleen. I'll ask my patient to inhale. So it's tympanic. There's no dull sound on the other side. So after that, after we palpate after we check the abdominal of my patient, we're going to check for the costovertebral pain. So I'm going to ask my patient to sit down for me. And then by using by giving a force on this costovertebral area, I'm going to give a punch or like light punch, asking if there is a pain.
No.
On both sides.
No. No pain.
No pain. So it means that there's no presence of kidney stone or possible pyelonephritis or nephritis. And then now, after checking the costovertebral, I'm going to ask my patient to stand to see, and of course to observe the spine. And it's straightened. I'm going to palpate the spine for any pain. You have any pain?
No.
And then I'm going to ask my patient to bend forward to check for any scoliosis or lordosis. And it's equal. All right? Can you sit down for me?
Okay.
Next is I'm going to palpate the shoulder for any tenderness, the tricep line, the bicep, the elbow, the hands for any pain. Also on this other side, the tricep, the bicep, the elbow, the hands, and the wrist. So I'm going to ask my patient to do the range of motion. So it's like if I says adduction, it means out. Abduction is closed. Okay? And then if I says flexion, it should be flexion, extension. All right? So can you do your hand fist first? Okay, and then abduction, adduction. And then can you do a extension, flexion? All right, so I'm going to ask for your elbow to straighten up. And then this is the pronation, and then supination. The elbow, then we need to check for the shoulders range of motion. It was like extension, flexion, extension, flexion, extension, abduction, adduction, abduction, adduction. All right. Then I'm going to give you force, and then put a resistance on your hand. Okay.
Okay.
All right. How about the other one? All right. Thank you. Your wrist. All right.
Okay.
Good. Okay. So after that, we're going to I'm going to check for the. We're gonna start for the upper extremities first.
Mm-hmm.
Okay. I'm going to check for the sensation.
Mm-hmm.
Okay. So the sensation is. Just let me know if you feel the sharp or the dullness. Okay. So I need you to close your eyes and tell me if this is a sharp or dull.
Okay.
Okay?
Sharp. 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 Sharp.
Dull.
Dull. Sharp. Dull.
Okay. And then I'm going to do a graffitisha for you. So I'm going to ask for you to open your palm, and then I'm just gonna trace a letter while closing your eye, and then let me know what is it.
Okay.
Okay?
H.
Okay, good. And also, I'm going to do on the other hand, I'm gonna draw some number.
Mhm.
Okay?
8.
Good. Alright, good. And then now, I'm going to give you something on your hand and tell me what is it, okay?
Okay.
So, for example, and then this one. So, I'm going to put this into your hand, in your right hand, and tell me what is it.
A cup.
Okay, good. And then how about this one? Still on the right hand. Can you check what is it?
A stone.
Mm-hmm. Good. How about on the other hand?
A stone.
Okay. This one?
A cup.
Good.
Okay.
So, sensations are fine and intact. The range of motion is intact. So I'm going to ask for your head range of motion as well. So I will ask you to do the flexion, bring down, extension, rotation, on the left, on the right, and then on the side. Do you have any pain in that?
No.
Good. And then after that, we're going now down to your lower extremities. So I'm going to ask you to lay down for me.
Mm-hmm.
So for the lower extremities, I'm going to ask for the sensation first. So let me know if it's dull or sharp. Okay? Close your eyes.
Down. Down. Sharp. Sharp.
Okay, good. All right. And then after that, I'm going to do a range of motion. Okay. First is the knee. So this is the knee. All right. 0 degrees, and then the 45 degree on the other side. All right. And then next is that the feet, your foot. All right, and your ankle. Going to the eversion, inversion. All right, good. How about the other one? Inversion, eversion, and inversion. Okay, flexion, extension. Flexion, extension. All right, and I'm going to palpate your knee. Kneecap is intact. Your joints in the ankle are intact. Phalanges, metatarsal phalanges are intact. Going to check your hips. It's intact. Do you have any pain in here?
No.
Good. So I'm going to do the hip range of motion. So this is abduction. This is adduction. Okay, the other one, abduction. And this is adduction. You have any pain in that?
No.
All right, so there's no pain on your knees, and your hips, knees, and ankle. And then the range of motion are uh, intact and full range. So I'm going to ask for the strength. Can you just push? All right, good. There's a good strength of your foot and ankle. How about your knee? Fight with me. All right, good. How about the other one? Give me a force. Good. All right, how about your hips? No. Okay, this one, just try to bring it up. Okay, good. I'll put outside. Good. Thank you, sir. Now, after that, we're going to check for the reflexes. So the deep tendon reflexes. So we're going to start from the brachial, and then your bicep, your tricep, your radial, your patellar, your Achilles, and then the Babinski.
Okay.
All right. So on the both sides, we're going to do first the bicep, and then the tricep, both sides, the bicep, the tricep, and then the what do you call this, brachial, and then the patellar. Okay, just relax. Okay, both sides, relax. Okay, and then the Achilles. Can you just sit down for me here, sir? Sorry. I'm gonna repeat for the patellar, both sides, and then the Achilles, and then for the Babinski. All right, another one. All right, good. There's good reflexes. So now I'm going to check for your gait. Okay, so the gait is, I want you to walk normally to me here, just few steps, standing straight, and then try to walk with me. All right, you can go. All right, thank you. Can you go back here? So the gait is steady, and then I want you to do